The liver parasite that connects humans and animals. Subscribe, comment. Integrative medicine. Soledad del Prado. Imagine a parasite so small it can go unnoticed, yet so powerful that it affects millions of people and animals around the world. This is Fasciola hepatica, known as the liver fluke, and the disease it causes, the liver parasite that connects humans and animals. Today we are going to discover together what this parasite is and how it is classified, how it reaches humans and animals, what damage it causes in our body, how to detect and treat it, and how to prevent it. Ready to begin this scientific journey? Let's begin. What is Fasciola hepatica? Fasciola hepatica is a parasitic flatworm, a trematode, that mainly infects the liver of mammals, including humans, sheep, cattle, goats, and other animals. Main characteristics: shape. It looks like a small flattened oval leaf. Size. Adults measure between 2 to 3 centimeters long and 1 centimeter wide. Color: reddish-brown or grayish. Habitat: lives in the bile ducts of the liver. Feeding: feeds on blood and liver tissue. Interesting fact: a single adult parasite can lay up to 25,000 eggs per day. Taxonomy: The parasite family. To better understand this parasite, let's look at its scientific family tree. Taxonomic classification: kingdom, Animalia, it is an animal. Phylum: Platyhelminthes, flatworms. Class: Trematoda, trematodes or flukes. Order: Echinostemidae. Family: Fasciolidae. Genus: Fasciola. Species: Fasciola hepatica, the most common. Other related species: Fasciola gigantica, more common in Africa and Asia. Hybrid forms between both species. Why is this important? Because understanding its classification helps us understand its biological characteristics, how it relates to other parasites, what treatments may work, how to prevent its spread. The parasite's journey, the life cycle of Fasciola hepatica is fascinating and complex. It needs 2 hosts to complete its cycle, a snail and a mammal. Let's follow it step by step. The eggs. Where, in fresh water, what happens? The eggs leave the infected animal or human through feces. In water, they take 9 to 15 days to mature, depending on temperature. Each egg measures approximately 140 by 80 micrometers. Where, fresh water, what happens? A larva called a myricidium emerges from the egg. It is mobile and swims actively searching for a snail. It only survives 24 hours if it does not find a snail. It uses chemicals to detect the snail. The factory. Where, inside the snail, what happens? The myricidium enters the snail. It transforms into a sporocyst. Here asexual reproduction begins. It becomes like a factory, producing more larvae. The multiplier. Where, inside the snail, what happens? Rediae emerge from the sporocyst. Each redia produces hundreds of cercariae. The snail becomes a true parasite factory. The escape. Where, from the snail into the water, what happens? The cercariae leave the snail into the water. They swim freely for a few hours. They search for aquatic plants or surfaces. This is the stage that leaves the snail. The infective form. Where, on aquatic plants or water, what happens? The cercaria attaches to plants or surfaces. It forms a protective cyst called a metacercaria. This is the infective stage. It can survive for weeks in the environment. It is resistant and waits to be ingested. Adult. The definitive host. Where, mammal liver, what happens? The mammal, human or animal, ingests the metacercaria. In the intestine, the metacercaria is released. It penetrates the intestinal wall. It travels through the abdominal cavity. It penetrates the liver. It becomes an adult in the bile ducts. It begins laying eggs, and the cycle repeats. Total cycle time. Inside the snail, 4 to 7 weeks. Inside the mammal, 3 to 4 months to become adult. Adult lifespan, 5 to 10 years in the liver. How do we become infected? Routes of transmission, the entry doors. This is the most important part for preventing the disease. Let's look in detail at how the parasite reaches humans and animals. Transmission in humans. Main route: contaminated food, raw aquatic vegetables. The most dangerous: watercress, Nasturtium officinale. The most common: wild watercress from rivers or springs. Water lettuce, water spinach, other wetland plants. Why is watercress so dangerous? It grows in waters where snails live. It is frequently eaten raw in salads. Metacercariae strongly attached to its leaves. It is difficult to remove them by washing alone. Real cases: in the Andes, Peru, Bolivia, Ecuador, traditional consumption of watercress. In Europe, France, Spain, salads with wild watercress. In the Middle East and North Africa, local aquatic plants. Contaminated water, sources of risk. Water from rivers, irrigation ditches, or canals, untreated well water, stored rainwater without treatment, water from natural springs. How does it happen? Metacercariae float freely in water. By drinking untreated or unboiled water, we ingest them. Even brushing teeth with contaminated water can infect us. Other land vegetables, less common but possible. Lettuce irrigated with contaminated water. Vegetables grown near wetlands. Aromatic herbs from humid areas. Fruit that falls to the ground in contaminated areas. Mechanism: contaminated irrigation water splashes the vegetables. Metacercariae are deposited on the leaves. If not washed properly or cooked, they remain alive. Transmission in animals also become infected in similar ways. Sheep, more susceptible than other animals. They graze in humid areas where snails live. They drink from contaminated puddles and irrigation ditches. They ingest metacercariae with grass. Cattle, they develop some immunity over time, but they remain important reservoirs, grazing in risk areas. Goats, very susceptible like sheep, browsing behavior in diverse areas. Horses, donkeys, mules, they can become infected although less commonly. They act as reservoirs. Pigs, important reservoirs in some regions. They consume contaminated vegetables and water. Risk factors for animals: grazing in humid or swampy areas, access to rivers, irrigation ditches, or puddles, rainy seasons, more snails, lack of parasite control, irrigation systems that favor snails. The snail, the key intermediate host. Without the snail, there is no disease. Main species: Galba truncatula, Europe, South America, Limnia spp. Various species worldwide: Pseudosuccini columella, Americas. Where do these snails live? Humid and swampy areas, edges of rivers and streams, irrigation ditches, temporary puddles, wet grasslands, water sources for livestock. Conditions favoring snails: temperature 10 to 25 degrees Celsius, optimal 15 to 20 degrees Celsius. Humidity, humid environments or stagnant water. Vegetation, aquatic plants providing shelter. Soil, muddy or rich in organic matter. Crucial fact: a single infected snail can release thousands of cercariae for weeks, contaminating large grazing or cultivation areas. Impact on organs, internal damage. Once we ingest the metacercariae, a destructive journey begins inside the body. Let's see what happens step by step. Acute migration, first 4 to 16 weeks. The journey begins. Small intestine, the metacercaria is released from its cyst. It penetrates the intestinal wall. It causes small lesions and bleeding. Peritoneal cavity, it travels freely through the abdomen. It may cause inflammation of the peritoneum, generalized abdominal pain. Liver, the final destination, it penetrates the glycan capsule, covering of the liver. This is where the major damage begins. Liver damage in the acute phase. Tissue destruction, young parasites feed on liver tissue. They create tunnels and galleries while moving. They destroy hepatocytes, liver cells, hemorrhages, internal bleeding in the liver, formation of hematomas, blood loss causing anemia, necrosis, death of liver tissue, areas of the liver stop functioning, formation of abscesses, pockets of pus, massive inflammation, the liver becomes inflamed, hepatitis, it enlarges, hepatomegaly, severe pain on the right side, organs affected in the acute phase, liver, main, intestine, peritoneum, gallbladder, sometimes, lungs, rare, due to erratic migration, chronic or biliary phase, after 3 to 4 months, the parasites become established. Bile ducts, adult parasites live here. They feed on blood and biliary epithelium. They remain there for 5 to 10 years. Damage in the chronic phase. Cholangitis, inflammation of the ducts, constant irritation caused by the parasites. The walls of the ducts thicken. Chronic pain, fibrosis, scar tissue replaces healthy tissue. The ducts become rigid. Bile flow becomes difficult. Dilation of ducts. The ducts enlarge abnormally. Biliary lakes form. Risk of secondary infections. Biliary obstruction. Parasites block the ducts. Bile does not flow correctly. Jaundice, yellow skin and eyes. Biliary cirrhosis. Advanced liver damage. The liver loses its function. It can lead to liver failure. Gallstones. Eggs and dead parasites form stones. Additional blockages. Severe pain. Biliary colic. Severe complications. Liver abscesses. Secondary bacterial infections, pockets of pus in the liver. They require drainage or surgery. Severe anemia, chronic blood loss. Extreme fatigue, general weakness. Malnutrition, the liver cannot process nutrients. If you are interested in this type of video for your information, comment. Until the next video.